All right, got a great topic today, and this is going to be the abdominoplasty and where does a abdominoplasty scar incision live? Well, let me tell you something. The basic idea of a tummy tuck is what we're going to do is remove all the skin typically below your belly button, okay? At the same time, we're going to typically tighten your abdominal muscles in the middle. And so the reason that happens is when you have children, there's a natural weakness between your six-pack muscles that separates. It's called diastasis. And then what we're going to do as plastic surgeons, we can restore the abdominal contour and the tightening of the abdominal tone by repairing that separation. It's called plication, diastasis plication. So that's that part when we actually tighten it. The skin below your belly button typically has a little more laxity from the stretch of having pregnancies. It's going to have maybe some stretch marks. You're going to have a little bit more of a lower abdominal fullness. So this is a very powerful surgery, the abdominoplasty, the tummy tuck, because we can restore the abdominal form again to where you're a little bit more, you're definitely more toned. Remove all the extra stubborn skin. That's not going to go away with diet and exercise. You can't do all the six packs in the world. It will not go away. I'm just sorry, ladies. I'm sorry to tell you that. This is the price you pay as a female woman giving birth to children. So this is going to be corrected. And so the question is no one wants that scar. No one wants a long scar. Everybody wants a C-section scar. It just doesn't work. And so the incision length is something you need to understand, and you also need to understand the placement of like how high on the abdomen it can be. And so on this diagram, I'm gonna just show you real quick that the idea is that you want to remove all the extra skin. So that will determine the length of the scar. That will determine how low the scar will be. So if you have a lot of stretch marks between, your belly button and this, and you also have stretch marks up here too, most likely you're gonna have a lot of laxity in your skin, so we can remove all that. And so the scar should be, theoretically, at least in my hands, we want a scar that's low. It needs to be low. In my hands, I want it curved along the pelvic line. It's an anatomical form, I think, that's more natural appearing. I want to keep it low. I want to be below a conservative bikini. I want you to be in a bikini after a tummy tuck. And so the distance from here to here is very important to understand, is that all that skin is going to go away. And the tighter that closure is, the more tension there's going to be, and you can have a scar that rides up, okay? So for example, you have someone who doesn't have a lot of laxity in their abdomen, and they still want a tighter tone because they have diastasis. We can repair that. So if you just go through some examples, is that someone like this, beautiful abdominal contour already. She has an area of laxity below the belly button. You can see the loosenesses. I call like a sad belly button, where the laxity of the skin is like overhanging the belly button. So restoring the abdominal contour by getting that skin removed is something that we can do. So I removed all the skin from basically here to here, like that. So all that went in the trash can, okay? The consequence of that is that you can see where her mole was here. I pulled the skin from here all the way down. So look where her mole is now in relation to her belly button. But the reality of it is that I couldn't get all the skin off. And so her belly button hole where it used to be is actually right there. You can see it right there in the middle, but it's gonna look like a stretch mark that she already naturally has, but her incision line is low. The big scar is very important to understand. That big scar is low. It's gonna be below a panty line, and you trade off with a small little scar. The option to that is that you're like, Dr. Morales, I don't want that vertical scar. Okay? The consequence of saying that, it means since I can't get that scar low, you would have a scar that goes like that. Okay? So then you have a scar that's like maybe that far away from your belly button. To me, I don't think that looks very good. That's my opinion of it. I want a scar that's low. You can see it's low. And then the small trade-off is you get a little small scar right in the middle. And this is what determines where your scar will live on your body. Another great example. This is someone who had really just kind of more of a laxity of the abdominal wall. This is the diastasis. Beautiful skin, didn't have a lot of laxity to it. And so when you don't have a lot of skin to take, but I still need to restore the abdominal contour by tightening the muscles up, sometimes if you have the right anatomy, it's called the umbilical float. I can actually float your belly button from underneath and not cause an incision around your belly button. So I release it from the bottom underneath the skin, and I just float it down a little bit, and I'm able to aesthetically still give you a better contour by restoring the muscle tone, by repairing the diastasis. But I didn't take a whole lot of skin. So her scar is actually very short because she didn't have a lot of skin. I just needed room to go to get all the way up to here and then tighten her back up in the midline. So this is one of the examples that I like to show of what can be done in a spectrum of abdominoplasty. We have a lot of laxity like her, tons of laxity. We have laxity here below the panty line. You can see the crease here. We got laxity on the hip line, all this laxity. She carried babies in the very central and a lot of babies in the front. Couldn't even see the belly button. But what we're doing here is restoring the abdominal contour both in the abdominal wall, but also removing all the stretch marks and scars. Again, what I want to see is that scar is low and we have it below a panty line. You can see the amount of stretch that the skin above the belly button is undertaken by pulling it down. That mole here is a good inch or so below where it used to be. And we have a nice restored contour. Did some silhouette contouring with liposuction on the sides. Her scar actually goes a little bit on her hips. Can you see the skin laxity on her hip area? So that's just one of again, trying to show you spectrums. Another example, you know, just a little more fullness of abdominal tone, lost a little bit of that tone from having babies, not a whole lot of skin. Same thing, pushed it in. With the plication repaired, didn't have a lot of skin, and I actually just restored her. This is her before. You can see the fullness here. Great skin already, not a lot of skin laxity, and then we got her into a position where a lot tighter abdominal form, and she has a scar that goes basically here, like this, and a small little baby one that goes like that. So I was able to get her skin to stretch all the way down to that point. So that's what that scar looks like on her. It's like right down like that. It's about skin laxity. It's about where you have the skin extra on your body, as well as understanding that the horizontal incision placement is very dependent on how much skin laxity you have above the belly button as well as below. And so what I don't like is having a scar that's way up here. Like I hate that scar. It looks terrible. What inevitably happens is that the mons area, the mons skin, the hair-bearing skin, will get pulled up like that.
Here's some info about skin.
So you might see like hair-bearing aspect of the mons area being pulled up. It's too high. This is something that you cannot fix. If you have a surgeon that has a scar that high in your abdominal wall after tummy tuck, this cannot be lowered. It's pretty much impossible unless you have a significant amount more skin laxity above the belly that we can re-pull down. So anyway, this is the nuance of a tummy tuck surgery. This is a very powerful rejuvenation surgery of the abdomen. It's one of my favorite surgeries to do. Aesthetically, you can have a really great contour, restored waistline, abdominal tone. You know, this is something that can happen after the price you pay as a woman to have children, and hoping to give you a silhouette and form that lasts a lifetime. It's a great investment, and you deserve it. Hope you learned something. I'll stay tuned for more.